She just had surgery.
I'm asking you to leave and give me an advocate, somebody else to speak with. I don't care. I'm not talking anymore about this situation. I'm in pain.
All right, good luck.
I said that I'm done talking. I want to be admitted. Why do you keep on telling me the same thing? I don't want to talk about this anymore.
What he's saying is,
no, I don't care. I don't care if I. Okay, first. Sorry, I really have no voice because I have been screaming for over 12 hours in this surgery after the surgery. So I wish I had like a microphone, but I'm gonna test this to see if you can hear me well enough. Okay. So I'm just gonna make this video in like a vlog type of way, just because I've been posting on my TikTok, and TikTok gives you like 10 minutes or so, I don't know, to talk, but people don't usually stay on TikTok long enough to hear. Now, I'm currently taking medication, so please bear with me while I like explain this whole situation and what happened, so everybody get a clear understanding of what happened. And because I've been called belligerent on one of my shorts on YouTube, and my whole thing is, how can I be belligerent and I'm literally in excruciating pain? Like, and I don't understand what this is, that where people don't believe you when you say that you're in pain. I have no history of drug abuse. I have no history of drug use. So for the hospital to look and see that I've literally only been admitted, I've never been admitted to the hospital. I've literally only been to the ER 2 times, and that was for this diagnosis. And to not see my pain as needing to be treated enough, I don't know, but just to explain the videos that I posted, or just the first video that is the one that went viral. So in that moment, I was looking at my mother and my sister, and they weren't recording or anything, and I'm just like, nobody is going to believe if I literally said I was screaming in pain and this man was doing nothing about it. No one is going to believe the things that he is saying. But because I was in such amount of pain, I couldn't record for long. I like put my finger on the record button, but I couldn't hold my phone because I had to hold my stomach, so I had to stop, which is why I only got like 29 seconds of recording. But okay, so this is what happens. So, I'm going to give the full view of everything that happened, and I'm going to try not to leave nothing out of this video. Okay, so in October of 2023, this past October, I had ate some cabbage, and the next day, like, I was just having such a hard time digesting it. It wouldn't go down. It only was coming up. So that's cool. I threw up, and that still did nothing. I still had this pain shooting from my stomach to my back. It was the worst. Okay. I go to the ER. They try to give me a few different medications, but it's not enough medication or it's not a strong enough medication to compact the pain that I was having. So my pain was still excruciating. And then they gave me morphine, which is how I found out I have an allergic reaction to morphine. And morphine makes my back and makes my my legs numb and tingly. It makes my back hurt and makes my legs numb and tingly. So they end up having to give me Dilaudid. They have to give me Dilaudid. So I'm also not going to edit this video or anything. Like, I want you guys to know exactly from beginning to end of how things happen. So I don't want it to be any, oh, well, you didn't talk about this part or you cut this part out. Like, no, I'm talking about specific, everything that happened from beginning to end. I'm sorry. Oh, that hurts my stomach when I have to do that. But, okay, so they had to give me Dilaudid when I went in October, and that was literally the only thing that took my pain away. But what I noticed that was good was that it took the flare up down from what I ate. It took the flare up down, and I no longer had to worry about that pain. I was able to go home and continue life as normal. I just realized I couldn't eat cabbage. And they also had found one gallstone, so they were saying I needed to get my gallbladder removed, which I didn't have a problem with that either because my mother had just went through that surgery earlier in October also. So then moving forward in November, I accidentally ate lettuce. Now at this point, I know cabbage, lettuce, soda, hot spicy foods are all going to give me the same reaction, so I'm not eating it. I accidentally ate lettuce because I've been eating lettuce all my life and I love lettuce, so it didn't cross my mind until I ate like 2 bites of it, and I just knew it was going to be bad, and it was. I went back to the hospital in November, and that's when I had to get the whole routine, and that's when they finally was like, go get your gallbladder out. So I go around and I find a doctor. I will say that when I went to the office to meet this doctor, this surgeon, he wasn't listening. Like, he wasn't listening then. And I didn't take it as he wasn't listening. Okay, I have to get my medicine. But I'm not sure where I left off at. Forgive me. But I think I left off with basically going through, they told me, I didn't know that was him basically not being attentive. I figured, I never had a surgery before, and they kept telling me, minor, it's a minor surgery. So I figured it was just not really much that we needed to discuss because it was a minor surgery. So I didn't look at him as not being attentive at that moment in that meeting. But okay, fast forward to the date of my surgery. It was December 8th, and they told me to be up there at 6 a.m. because I was second to get this surgery. And I did. I came at 6. Everything was good. They asked me about allergies. I told them morphine. I will say every time I told them morphine, they'd be like, oh, what? Your back hurts more and your legs are numb. That's odd. And it's just like, if I tell you that this is what it does to me, do you want me to get the morphine so that you can see it happen to me? Like, what's the point in asking me? And that would be the only thing that I say before surgery. Other than that, everything was pretty cool. I just had my gown and I just waited for my surgery. Now, they take you down to a part of the hospital right before you go back to have your surgery. And that's when the surgeon came over to me, and he was like very flustered. Like, it was cold outside, I guess, but to me it wasn't that cold. But he's like, I won't say his nose was running, but he was just like, and then he had his keys in his hand and his coat, and I was just like, what is going on with him? But again, at that point, I'm nervous about my surgery. I'm not trying to really think too much about him. I don't know. I cannot explain my thought process when seeing him. It's just like, it was more so for other people around me to say something about the way he was acting than me. That's where advocacy comes in. Like, I shouldn't have to advocate for myself and be nervous about my surgery and be, you know what I'm saying? So, but whatever, they end up having me say goodbye to my sister, and then they took me back to the surgery. I saw the surgery room before I was put under anesthesia for my surgery. And this was probably like at 10. No, it was probably like at 9 a.m. I think. So I get out the surgery. At this point, I'm in anesthesia. They take me to a room, I guess, and sorry, y'all, my throat is like so dry. They take me to a room where they wake me up. When I woke up, all I remember is a whole bunch of people being around my bed. One telling me, you just got out of surgery. The other telling me, you need to calm down. Another person telling me, you're not going to get medication unless you tell me your name. At this point, I was like screaming in this pain. oh, this pain was the out of this world pain. Like the pain that y'all saw me screaming on the video about, no, 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 no. This pain was way worse. It was a stomach spasm. I know it was a stomach spasm because I remember being in the gym and I remember having this feeling when I did the crunches and I thought I was about to die. This is the pain that I woke up to, but it didn't ease up. Like it just kept going. And so that's why I woke up screaming. And they literally, like, if they could have held me down and covered my mouth, that's what they would have did. Because I don't know if they don't know how to handle a patient screaming or what, but to tell me, like, you need to be quiet or I'm not going to give you any medicine. You need to tell me your name and your birthday or I'm not going to give you any medicine. And it's like, I can't even talk. The pain that I'm in, I can't even talk. And this is for real. Okay, so they finally gave me medicine without me having to say my name or anything because I couldn't. Like, all I kept saying was my stomach. Like, they just wasn't hearing me. They was thinking, like, my stomach is hurting from the surgery, but my stomach was hurting from a stomach spasm. Okay, so the lady, she ended up giving me something. It didn't really work. It was kind of like fentanyl, which I'll get to that, but it didn't really work. It helped for like a little moment, but then my body was back hurting again, and not hurting out of surgery. Like, I understand that it's going to be pain out of surgery. It wasn't that type of pain. It was like an excruciating pain. But it was another guy who was sitting next to me who had just got out of surgery, but he was very talkative. And I heard him like talking about me. And he was like, oh, she's having a hard time out of the surgery. She needs to just calm down and then, she won't feel the pain. And the lady was agreeing with her, who was supposed to be my nurse. She was agreeing with him. She was like, yeah, she needs to calm down. I'm not going to give her any medicine until she calms down. Like, all types of HIPAA violation, talking to the man about me. But then they couldn't calm me down, so they called for my surgeon to come down and talk to me. Because I didn't know anybody that was right there. None of those people I had met before my surgery. So they called for him to come down, and he told them he wasn't coming down. And I know that he told them he wasn't coming down because it's what they said. I was sitting right there and I was screaming in pain, and all I hear is, have Webb come down. Tell Webb he needs to come down. And they said, Webb said he's not coming down. Just give her some medicine. Webb said he's not coming down. Okay? So Webb said that he wasn't coming down, and Webb is my surgeon. He's the one who just cut me open. So they end up giving me Dilaudid. Now, remember, Dilaudid is what I had got at the ER in November and in October, and that is what helps me. That is what helps my system calm down for some reason. It's not the other medications that do it. It's Dilaudid. And if you look up Dilaudid, that's what Dilaudid is for. So I don't know why they act like I'm asking for some crazy medicine when I ask for Dilaudid. But, okay, so then we move to, I'm now calm. The only problem that I'm having now is my oxygen is too low. So I keep going in and out. And the lady, the nurse, she'll come over and she'll like do like this to my arm. And like, she'll do like this to my arm. And I feel like to my face a little, but it was how I was laying. But she'll do like this, and she'll be like, you need to get up, your oxygen is dropping. And every time I pass out again, she'd come over and do that again. And I had said this to the other surgeon, that I didn't like the way she did that. And he was just like, well, maybe it was because, your oxygen was going low. And sometimes that just means that you're going back into your deep sleep, so she had to wake you up. But that's not bedside manner. Like, it's a way that you can come over and say, Marshayla, you have to get up. Or, or your oxygen is dropping, I need you to get up. Can you tell me your name? Instead of coming over and slapping me. And, okay, so Now they take me upstairs to my room where I was before I had the surgery and where my mother and my sister is. They take me upstairs and I don't remember anything from this. I remember getting rolled into the room, and then I just remember and then I remember waking up like probably 30 minutes later, because when I looked at the clock, like time hadn't passed that much. So it was probably like 30 minutes later that I woke up. And when I woke up, everything was moving so fast because nobody was giving me time to settle. I understand this is an outpatient surgery and I'm supposed to go home to recover for the rest of the way. But goodness, give me some time to breathe, some time to understand what is going on. Talk to me about what happened in my surgery. Nothing was happening. It was a nurse. She was red. She had red hair, and I think she was pregnant. I'm not sure, but she walked in and she was like basically getting my stuff together. She was like, okay, this is what you're gonna do. You need to take your socks off, or you need to put your shoes on, or like basically just getting me ready to go. And she was like, and then this is what you're gonna do. She was giving all of the instructions, and she was like, so if there's a lot of gas, because they use a lot of gas when they do the laparoscopic surgery, you may feel pain in your shoulders or something like that. Like basically just reading a book to me. That's how she was. That's the only way I can explain it. Well, she was reading a book to me right out of waking up from a medicated state. Okay, so she got to the point where she said, you're going to need a soda because you're going to need to burp up some of the gas. And I'm right out of a medicated state, and had I been thinking, I would have said, no, I cannot drink soda because my stomach just got worked on. It's probably going to flare my stomach up again, and I'm going to be in pain. But I couldn't because she was talking to me right out of being medicated. She didn't give me a chance to wake up and be in a state to speak for myself. So she ended up bringing the soda, and I have to drink the soda to burp. So I'm drinking the soda, and then all of a sudden I'm like, I feel like pain coming. Like, can I get some medicine before I leave? And she said, well, you've been prescribed oxycodone and ibuprofen. So I'll bring you an oxy, which they call Percocet. I'll bring you that, and you can take that, and then you can put your clothes on and you can leave. Like basically, you can put your clothes on and you can leave. And so I'm like, okay, whatever. So she bring me the medicine. I take the medicine. 20 minutes go past and my pain is getting worse. When she brought me the medicine, my pain was probably at like a 5, 6-ish, because it's kind of like where it is right now. It was like at a 5 or 6. But when the 20 minutes passed by after I took that oxy, my pain was like at an 8, 9. I was on my way to a 10. So they keep coming in, and I keep telling them I need more medication. I need a different medication. I need an IV because this medication that y'all gave me is not enough, and I don't feel comfortable going home like this. Because mind y'all, I just told you in November and in October, I had been to the hospital for this same exact thing. So I knew what I needed to calm the flare-up down, and it was not an oxy. So she said, there's nothing we can do for you. That is the strongest medication that you could be prescribed. Everybody kept saying to me these same words, and you're going to hear me say this a lot. You have to know that you're going to have some pain out of surgery. As if I complained about the pain out of surgery. When she woke me up and she was giving me that rundown about I'm going to have, my shoulder's going to hurt because of gas and this, that, and the fourth, I was perfectly fine. I was like, okay, cool. I guess she's sending me home. It wasn't until she gave me the soda that flared up other parts of my body that took me into the excruciating pain that I couldn't bear. So once again, this is why I said they weren't attentive, they weren't listening, they weren't paying attention. None of the things that they have did their oath to do. So, okay, so Now, she gave me the soda. I talked to the nurses. They kept coming in and trying to tell me the same thing, that I'm not going to get any medication because that's the highest prescription you can give for a pill for at-home medication. The only other medication you can get is through an IV at the hospital. Which is when I said, okay, well, give me the medication in the hospital because I cannot take this pain. It's too much. I don't know if anybody watching this have had back pain, stomach pain, and surgery pain at the same time. If you've ever had all of those at the same time, you know that it is not bearable. So, okay, I'm telling her, like, this pain is too much. Like, so go get my surgeon in because at this point, I cannot, I can't. I don't know what you guys are expecting me to do, but I'm not going home. And I want people to know watching this that you have that right. Like, you don't have to go home if you don't feel comfortable. Especially with a situation like mine, just coming out of surgery and telling the doctors that something is wrong. They were supposed to listen. Okay, so they tell me, like, your surgeon will be here. No one came in. No one rubbed my shoulder. No one cared. That's like the best way I could put it. Whatever you would amount someone caring to do, no one did it. Nothing was done. I was looked at crazy. And then you have people on different levels. So you have like the charge nurse, and you have the doctors and the surgeons, and then below the charge nurse you have certain different levels of nurses. And it was the nurses that were like at the lower levels that would look like they wanted to do something and look like they felt bad, but obviously they can't do anything because their boss, the charge nurse, and the surgeons and the doctors and stuff like that. So, okay, fast forward, my surgeon comes in, and at this point, y'all saw on the video, if you heard me on the video, you know that pain was beyond a 10. I was going into 100. Like, that pain, I think that because my adrenaline was up so much from just being angry that nobody was listening to me was the only reason why I wasn't like passed out. Like, I knew that I had to. I had to. Nobody else was going to do for me. Like, I knew that I had to speak for me. I knew that I had to be the one to stand my ground and say, no, you're going to admit me. I knew that I had to do that, which is the only reason why I wasn't laid out on the floor. So the surgeon comes in and he's like basically trying to give me the same pitch that they've given me, as in a condescending, did you think I was going to say anything differently? So he comes in and he says, I'm not able to give you any more medication. You have your highest medication. Like, it takes 30 minutes to an hour for the medication to work. At this point, guys, we're at the hour. They've been telling me this since 22 minutes in of me taking the pill. We're at the hour now, and the pain has not subsided. So I told him this, and I'm like, okay, we're at the hour. What do we do now? Because are you guys worried about my blood pressure? Are you worried about my oxygen? Are you worried about anything? Are you worried that I'm a human being? So he says, he wanted to keep going around about that I couldn't get any more medication, a higher dosage of medication to take home. And at this point, I told him I was done with the take home. I need an IV. And he said, I cannot give you any more medication than you've already gotten. And I said, okay, well, then I want to be admitted. And he said, no. He said, I'm not going to admit you. Why would I admit you? This is normal pain that you go through with the surgery. And I told him, it is too much pain for me. This is not normal pain. You said mild to moderate pain. Mild to moderate pain. I am beyond excruciating pain. So this couldn't be normal pain. So he said, I'm not going to admit you. That is a $2,500 bill. $2,500 was his exact words. Bill to get admitted. As if he knows what my bank account looks like. As if he knows what God can do for me. As if he knows anything. He amounted my life in that moment to $2,500. And I told him, I don't care how much it is. I don't care about any of that. I want to be admitted. He went back and forth with my mother about how this medication is the best that they can do. It don't matter where I go. They're not going to give me any more medication because this is a mild surgery. It's an outpatient surgery, so he's not going to admit me. And I kept telling, and what I think was making my pain even worse was that I had to keep on screaming. I'm telling my mother, stop talking to him. We're done talking to him. Like, I don't want to talk to him anymore. I don't care about anything that he's saying. Go get me a patient advocate. And that's when y'all hear me on the video telling him to leave, and I had to keep saying leave more times than that video showed because he wouldn't leave, which is why I grabbed my phone, because I'm like, this is crazy. This man won't leave. He just keeps on talking to me about the same thing over and over as if I'm not in pain. And the fact that you won't leave means you really don't care. You don't care if I pass out right now. That's probably the best bet for you, is for me to pass out, so you can make up a whole bunch of lies and I can't speak for myself. So I kept screaming, leave, leave, leave. I want a patient advocate. I want a patient advocate at this point. Somebody who's going to advocate for me, because you're not it. So he walked out after saying he don't care. Again, these are his words. And I have witnesses. Okay, sorry y'all, this camera keep moving. I got to keep switching around because I haven't took any medication yet, because I want to make sure I get this video out. But he kept saying, after he said he didn't care, he walked out, and you see his shoes leave on the video along with the nurse. Now, a few minutes later, the nurse comes back with some paper, I don't know, and she's like, she didn't tell me that they were about to take me to the ER. She came in and her exact words were, they're not going to give you any more medication than you already have gotten. This is an outpatient surgery, so you don't need to stay in the hospital for it. She basically reiterated everything again, and I told her, I don't care about anything that you're saying, and I want you to leave too. Stop talking to me. Leave. She would not leave. I had to scream, stop talking to me and get out. And then she said, oh, I'm just letting you know. I'm just telling you the information that I... Okay, so then I told my sister, I said, go get me a wheelchair so we can go, because she wouldn't leave still. She said, well, the nurse, it wasn't a nurse, it was another guy. She was like, he was going to get a wheelchair for me. Why didn't you start with that when you came in? Why, when you came in, did you say, we're going to take you to the ER, because you asked for it? Okay. So he comes and he takes me, he drives me through the wheelchair. Mind you, they don't think I need to be on a bed with this type of pain. Just put me in a wheelchair and take me. But yeah, so they take me through the wheelchair all the way to the ER. The ER, I am screaming literally at the top of my lungs at this point. Like, sitting up in that position in a wheelchair was only making it worse. Right hand to God, like, I cannot make these things up. I sat in that ER, I feel like had to be an hour, over an hour, before they even seen me to get my blood pressure. And then they asked me a whole bunch of questions, and my family couldn't speak for me. They couldn't speak for me. Even though they've been here the whole entire time, they couldn't speak for me. They would say, we need you to talk, you to speak. Even though I'm saying my pain is beyond an excruciating level, they want me to speak. So, okay, I grit through my pain and I speak as best as I can. They take me back out to the waiting room and have me screaming out in the waiting room for even longer. So then all of a sudden, because I feel like I was going in and out with my pain, like I was screaming, but I was, I don't know, like I wasn't all the way there. Like time was not a thing for me. It was a thing as far as pain, but it wasn't a thing for me as far as like I could clock. It's been 5 minutes. It's been 10 minutes. So the lady, all I know is I was like drove over to a corner of the ER waiting room, and I'm thinking I'm about to go to the back, and I'm like, why are they taking me over this way? And they took me that way last time. So she takes me to a corner of the waiting room, and the sign says stairs. So I'm like, why am I over here? And she tells me, and she's saying it in like a hush whisper, but a little loud. She's like, you need to calm down. You need to be quiet. I'm going to get you some help if you can calm down. If you be quiet, then we can look and get you a room. But you're going to have to calm down. At this point, I started getting, my blood pressure had to spike because I started breathing harder and heavier because I'm like, did this lady just bring me over to a corner of the ER and tell me to shut up, basically? She came over, and then another lady came over with her, and they were just staring down at me. And I told the lady, I said, if you were having stomach and back pain at the same time after a surgery, do you think that you will be able to calm down? And she said, no, but I'm going to need you to be a little quieter. So at this point, I don't even know how to express my pain, because when you are in pain, you are known to moan and groan, and it may be louder depending on how much the pain is. It may be softer depending on if you can bear the pain. So at this point, I feel like she kind of gave me a little PTSD by doing that, because I don't even know how to assess my pain on my own as far as me handling it through moans and groans. So at this point, I'm like just back to normal, trying to do my moans and groans as I was to get through the pain, to finally get to some medicine. And she's like, yeah, you need to be a little softer than that. You need to be a little quieter than that. And I was done talking to her. Like at this point, I was just back to what I was doing. I was just screaming out the pain because I couldn't take it. I don't know what she's over here talking about, why she would grab me and pull me to the side and try to tell me she understands, but then tell me to be quiet and I'm too loud. At that point, my pain, I was at like I was like, oh, or I'm trying to give the sound. I was like, like I was like trying to hum it out, and then I would have to breathe it out, and then I would have to. So I was breathing. She tried to say you need to breathe, and I'm like, I am breathing. You just want me to shut up, basically. Okay, so she takes me back over to where I was at, and at first I was facing away from people because everybody kept staring at me. She faced me directly to people and walked away. Okay, so then say about another 40 minutes probably went past. And I only know this because of when I would look at the clock once we finally made it to our destination. And they took me to the back. They took me to the back, and it was a nurse. She said, first, no one came for a long time. I said like 40 minutes went by on the clock. And then a nurse came in. She asked me questions and this, that, and the third. And she said, okay, well, I have to go get the other nurse to look at you first. Again, she didn't ask me any questions about any history I've been through, anything that I could think is going on, what pain am I feeling, nothing. She asked me nothing. She said she had to go get another nurse to go over things with me. So 40 minutes go by again. Again, I have no medication. She goes and another lady come in with a white coat. Now, this lady was a student. She came in and asked me the same questions. And then she said, okay, I'm going to have to go get a nurse, and walked out. Okay. So then Right after that, the lady comes back. The first lady comes back, and this time I'm in the ER, guys. The first lady comes back, and she says, "Oh, was that the charge nurse?" And my mother said, "No, there was a student." And she said, "Oh, well, oh." And then she walks out, and she says, "Well, let me go get the charge nurse." Another 30 minutes go past, maybe. Charge nurse comes in, and she says, she looks at me, and she looks at me like, I'm going to see if I could do the look. Like, she said, I talked to Dr. Webb, which is my surgeon. She said, I talked to Dr. Webb, and you do realize that you're going to go through some pain after having a surgery. At this point, I'm still moaning, groaning because I'm still in pain. And I said, yes, I do. As much as I could, of course. And she said, well, Dr. Webb said that he would admit you, but he said that he would admit you. I don't think she gave a but. She said he said that he would admit you. And I think I cut her off. That's why I don't remember the rest that she said. 'Cause I looked over at my mother and I said, did he say that? Just for confirmation, because I know exactly what he said. And he said that he wasn't admitting me because it would be $2,500 that I would be billed for. And she said, well, so let's see. She asked me about the morphine. I told her I couldn't do that. So then she walked out. She didn't tell me any plans that she had for me or anything like that. She said that I was going to get admitted, and that's it. And she walked out. She didn't care about any complaints that I had about Dr. Webb saying that he wouldn't admit me because it would be $2,500. She didn't care about any of that. She walked out. And that was Nurse Katlyn. And I have like all of the information on my chart of what they lied about, because they lied and said that during this time. So yeah, people like to play. But at this time I'm in the ER, guys, and she lied. Dr. Katlyn lied, or Nurse Katlyn lied in my chart and said that I had been going to the bathroom by myself, that I didn't need any help going to the restroom, and I needed at least 2 to 3 people to help me to the bathroom and to help me over the toilet, because I was not sitting on the toilet. I was squatting. So I needed 2 to 3 people to help me use the bathroom. And in my chart, it says I was coherent. I was able to understand everything. And mind you, I said that I've been going in and out. I was able to understand everything, and I was able to go to the bathroom by myself. So at this point, a nurse comes in and she gives me fentanyl. And first, she gave me something that wasn't anything. And I remember looking at her, and she had like this guilty look on her eyes, like, I don't know, like she tried to give me something to see if I was going to act like the pain subsided. And I was still in pain, so I'm just looking at her like, what did you just give me? Because it was absolutely nothing. And then that's when she gave me the fentanyl, and after like 5 minutes, I could feel it. Because had she known, had they asked me anything about my medical history, they would know that when I get medication, I don't feel it immediately. I feel it like a few minutes later. So she would have known that you couldn't try to pull the wool over my eyes and give me some fake stuff and then try to call it medicine. But they gave me the fentanyl, and it helped for a tiny bit. I was finally able to stop screaming and drink something. But it didn't take the pain away. And I'm not talking about the pain from my incisions. I'm talking about the pain from overall my stomach and my back that was from the flare-up. It didn't help with that. So, I had told her, like, that pain, that fentanyl did not help me. If anything, it kind of gave a reaction like the morphine. Like, I felt it in my legs a little bit, and I felt it stronger in my back. Like, it helped with, and I take that back, it helped with the incisions part. I couldn't feel the incisions from the surgery. I just felt all of the other pain. So the fentanyl helped with the surgery part. But it didn't help with my other pain. It actually made my back a little worse, just like the morphine. So I asked for them not to give me any more fentanyl. So, this is when she gets confused, and she's like, well, if you can't take fentanyl, you can't take morphine, and you can't take Dilaudid, what are we supposed to give you? It's almost like no pain medicine works for you. And me and my family had to stop her and say, what are you talking about? I never said that I couldn't take Dilaudid. And I only said that the fentanyl is giving me the same reaction as the morphine. So I'm not sure if I can't take it. But I know for sure I can't take morphine. What are you talking about? And she was like, oh, I'm so sorry. Oh, I thought that you were saying you couldn't take any of the medications and you couldn't take Dilaudid either and da-da-da-da. And I'm like, you wouldn't have thought that if you just listened, because we're speaking English. So, okay, so moving forward, she finally leaves and says that she's going to go talk to the nurse about me getting Dilaudid, because at this point, none of this medication is working, and they claim they care so much about my blood pressure and my oxygen levels, and they want me to calm down, but they're not giving me any medication to calm down. So, oh, jeez Louise. I'm definitely have to take some medicine. Because my stomach is like tightening up from me doing a lot of talking. But they never came back. They sent the nurse home, who went back to the charge nurse to get me medication. They sent her home. I asked for something to drink, and they told me that a nurse had to bring it to me. 6 hours go by. I haven't had any pain meds. I haven't had anybody come in and say anything to me. I haven't had anything to drink. No one brought me ice chips. Nothing. 6 hours have went by. We are now at 12 a.m. going on 1 a.m. It was 12 something a.m. My mother at this point is tired, and her legs and her body are starting to hurt. So she's like, where's the room? Da, 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 da. They tell her, oh, we have the room. We have to give her a COVID test and take some more blood work before she leaves. So she kept saying, well, when are they going to do that? 30 minutes go by. Another 30 minutes go by. And they come in and do stuff very slowly. So when he came in and he did the COVID test, or she did the COVID test, and they did it was 2 people, they did the blood work and everything. They said that I had to get IVs and things because they suspected an infection. And I'm like, well, that makes sense as to why my surgeon lied and said that he was willing to admit me when he wasn't, because they said that they suspected an infection. So that's why you lied, because now you're like, oh, something could be wrong. Okay, I can't make this up, guys. This is real life. I have witnesses. So after like 2 hours go past, they finally take me upstairs to the overnight area where you get admitted to. And I will say that night team was so compassionate, and it was like a breath of fresh air after so much mistreatment in that hospital. The only problem was the charge nurse and on that night team, because she just like looked at me with disgust. And she I remember I had asked for Dr. Webb not to be my doctor anymore. It was 2 a.m. at this point, almost 3. And she came in and said, well, you're going to have to find someone else at 2 a.m. Or do you just want to settle with him? And I just was looking at her, and then she just twirled out and walked out. So I say she was the worst part about that overnight team. And then, the morning team, I made a little video about it, how they just basically tried to push me out the hospital. Even after I asked, can I get the medication that I'm supposed to go home with, to make sure that I don't have any reactions to it, because I've been having reactions to certain medicine. And even after that, she gave me the medication and brought me the papers in at the same time to sign out. And I'm like, how am I going to assess if I'm having any reactions to this medicine if you're asking me to sign out right now? So it was just problem after problem after problem. And even now, I have so much PTSD of making my follow-up with this doctor. Like, excuse me, it's horrible. But You guys could follow me on TikTok. I try to keep everyone updated as much as I can in and out of the medicated state that I'm in. And now I'm going to take my medicine. I've talked enough. My voice is gone again. Thank you.